Guys, if you all could remember, once I did a video on testosterone in which I shared some interesting facts on the hormone. The hormone is known as man hormone. However, this hormone is created by both men and women. Molecules called hormones control how the body functions. They typically originate in one body area before moving on to the other organs. In this video, I'll discuss a little more on testosterone, mainly about the low testosterone level in men, its causes, symptoms, and some therapies which are suggested. So stick to the end of this video to learn it all. The hormone responsible for male sex, testosterone, is produced in the testicles. The average growth and operation of male sexual organs depend on the amount of hormone testosterone. Male characteristics including body and facial hair, a deeper voice, and stronger muscles are developed in boys during puberty with testosterone. To produce sperm, men require testosterone. Older men typically have low blood levels of testosterone because testosterone levels generally decline with age. Low testosterone levels can occur in some males. Testosterone deficiency syndrome or low testosterone is the medical term for this. A lack of a substance indicates the body does not have enough of it. A syndrome is a collection of symptoms that collectively point to a particular illness or condition. Teenage guys with insufficient testosterone may not go through the typical masculinization process. For instance, the genitalia might not grow. There might not be much body or facial hair, and the voice might not naturally deepen. Additionally, testosterone might support a regular mood. This hormone may have additional crucial roles that are yet to be fully understood. It is a prevalent belief that testosterone, the hormone associated with men and aggression, has a close relationship with violence. The proof is all around us. Castration, the removal of the source of testosterone, has long been a standard practice in animal husbandry, and weightlifters who abuse anabolic steroids experience roid rage. But what kind of relationship is that exactly? Will a regular man transform into the Incredible Hulk if you inject him with testosterone? And do violent guys have higher testosterone levels than their more submissive counterparts? Well, according to Frank McAndrew, a psychology professor at Knox College in Galesburg, Illinois, researchers expected a rise in testosterone levels to necessarily lead to more violence, yet this didn't regularly occur. The most recent studies on testosterone and aggression show that there is only a tenuous link between the two, and the relationship practically vanishes when aggressiveness is reduced to direct physical assault. According to what is known at this time, McAndrew notes, testosterone is produced to get the body ready to react to challenges or competition. Any stimulus or circumstance that indicates one of these things can cause testosterone levels to rise. It makes sense because testosterone helps both men and women become bigger, stronger, and more energetic in the short term, all of which are beneficial for triumphing in a physical or even mental competition. According to some academicians, testosterone also fuels libido in both sexes and drives our desire for social dominance, which is one way that humans choose who gets to mate with whom. Now look at some causes of men's testosterone low levels. The body uses cholesterol to make testosterone. However, a high cholesterol level does not guarantee a high testosterone level. That cannot happen because the pituitary gland in the brain tightly regulates testosterone levels. According to a researcher, Dr. Samadi is a doctor from USA. If you all are interested, you can listen to him on YouTube also. So according to him, some diseases such as type 2 diabetes, chronic liver or kidney disease, COPD or other lung conditions, or issues with the pituitary gland might result in lower testosterone levels in younger men. There are some syndromes, Klinefelter syndrome, Kalman syndrome, Prader-Willi syndrome, and myotonic dystrophy are some genetic reasons for low testosterone in men. Hemochromatosis, a condition where the body stores an excessive amount of iron, is another ailment that can result in low testosterone. You can Google all of these to learn more about them. Low testosterone can also happen when something prevents the testes from producing the hormone, such as trauma or steroid use. Pituitary gland tumors, HIV infection, and radiation therapy or chemotherapy for cancer are among other factors that contribute to decreased testosterone in males under the age of 50. Doctors categorize low testosterone causes as primary or secondary. A dysfunction in the testicles is the cause of primary hypogonadism, says Dr. Samadi. This might result from radiation or chemotherapy treatment, a testicular injury, or developmental problems. The testicles are normal in secondary hypogonadism but don't work correctly because of a pituitary or hypothalamic disorder. Now we'll look at some signs and symptoms of low testosterone in men. Men with low testosterone levels may experience symptoms that impact many different aspects of their health and well-being. When their testosterone levels drop, many men have sleep problems like sleeplessness, emotional changes like sadness, and problems with their sexual function and cravings. Some men even have changes in fertility, a loss of strength, and weight gain in addition to these symptoms. Energy deprivation can also affect athletic performance, making it more challenging to gain muscle and burn fat. Less muscle and body fat may raise the risk of diabetes, heart disease, and other illnesses that depend on a healthy metabolism. Erections may be challenging to obtain or maintain when testosterone levels are low. Erectile dysfunction, however, is not necessarily directly related to insufficient testosterone. It might be challenging for people with high testosterone levels to get erections, and the opposite is true for those with low testosterone levels. Nitric oxide is produced as a result of testosterone stimulating the penile tissues. This triggers a chain of events that leads to an erection. A man might not be able to get an erection if the hormone levels are too low. Among the additional causes of erectile dysfunction are smoking, thyroid-related conditions, high cholesterol, anxiety or tension, drinking, diabetes, and high blood pressure. According to studies, testosterone therapy can enhance erectile function. Males with low testosterone may have a decrease in testicular size. Additionally, the scrotum may feel softer than usual. The majority of a man's ejaculate is made up of semen. The sperm can travel closer to the egg with the aid of this fluid. Semen production is stimulated by testosterone, and lower levels of testosterone can significantly lower semen levels. Fertility problems may result from it as well. Low testosterone users could have trouble falling or staying asleep. Males with sleep apnea often have low testosterone levels. According to some researches, low testosterone levels are also associated with a lack of focus, irritation, and depression. According to a reliable source, testosterone replacement therapy significantly improved the general quality of life and symptoms of depression in men with low testosterone. Testosterone therapy or more testosterone may be advised if your testosterone level is less than 300 nanograms per deciliter. Different testosterone formulations, including topical gels or patches, injections into the muscle or skin, nasal gels, long-acting pellet implants, and other choices can be used in treatment. Some doctors suggest that one treatment is not suitable for everyone, and doctors must distinguish between a younger man with low testosterone who wants to be fertile and an older man with low testosterone who wants to regain his vitality and desire. Reports also suggest that testosterone levels should always be evaluated before starting medication, because giving therapy or treatment without proper testing or evaluation will not be safe or effective. So folks, that's it for the video, and I hope you liked and enjoyed it. In some other video, I'll tell you how you can keep your testosterone level high naturally. Yes, if you keep your diet and lifestyle correct, you may not need to go for any of those therapies. You can keep your testosterone level good just by intaking suitable food and following certain habits. But we will talk on that in some other video. For now, you just press that subscribe button and the bell icon so that you get notified every time I post a new video. And take care of yourself. I'll see you in the next one. Till then, hasta la vista. Peace.